when someone is concerned that their relative or their friend is potentially feeling suicidal, it's important to ask not just a general question, but to actually start to dig down a little bit and try to understand how serious these thoughts might be. So if someone says, yes, I have thought about giving up on life, the next question is, have you thought about suicide? Yes, I've thought about suicide. Do you have a plan? Yes, I have a plan. What's your plan? Where might you do this? What might you use? Any detail, I think, is important to understand and then to help remove the means. So particularly if someone, for example, is thinking of using a firearm, to make sure the firearm is removed. Interestingly, we know about suicide that women attempt suicide much more often than men, but when you look at completed suicides, men complete suicide 2 to 1 more often than women, and it's largely because of the method they choose. It's not because of the intent that they have. Men tend to use firearms, women tend to take overdoses, and firearms are far, of course, more lethal. But when we look at, does that mean the people who use firearms intended to be more lethal than the people who took overdoses, it turns out that's really not the case. So it's really important to try to find out what someone's thinking, what someone might use, and then remove the means as best one can. But clearly, when you get into this neighborhood, it's really critical to have mental health professionals working with you.